Good afternoon. I'm Serena Collado, Director of Community Health at Robert Wood Johnson University Hospital, Somerset. Thank you for joining us for our webinar today, Get PrEP to Prevent the Spread of HIV and AIDS, presented in collaboration with Friends Health Connection. About 1 million people in the United States are living with HIV, and about 14%, or 1 in 7 of those, don't even know they have it. On today's show, we will talk more about the risks of HIV and how it is diagnosed and how to prevent the disease. Joining us today is our special guest, Danielle King, coordinator and navigator for our Proud Family Health. Thank you for joining us today, Danielle.
No problem.
So Danielle, why don't we get started by having you tell our audience a little bit about yourself and what you do at Proud Family Health.
Okay, so a little bit about myself. I have my master's in public health, epidemiology, and health education. Out of my master's, I started working for Hyacinth AIDS Foundation as an HIV counselor and tester. And then I also moved into doing policy work. For Proud Family Health, I'm the patient navigator, which means that I help the patients navigate the system, not just Robert Wood Johnson system, but also the systems outside of our services. For the coordinator aspect of what I do, I basically act as a bridge between the community and Proud, bringing them into the office and making them aware of the services that are available.
That's fantastic. I know the system can be very challenging for many folks,
Yeah.
so thank you for doing what you do. So let's start off with a basic question. What is HIV?
So HIV stands for Human Immunodeficiency Virus. And what HIV does is that it attacks cells that help the body fight off infections. So if a person gets HIV, this makes them more vulnerable to other infections and diseases. HIV is spread by contact with certain bodily fluids, being blood, semen, vaginal fluids, rectal fluids, which is something that was recently added, and breast milk. With HIV, if it's left untreated, it can lead to the disease called AIDS, which is acquired immunodeficiency syndrome. A person will become diagnosed with AIDS when their CD4 count, which is what HIV attacks, drops to a level lower than 200 cells. And what's important to know is that not everyone with HIV will develop AIDS, but taking your medication every day as prescribed will help a person stay healthy.
Thank you. That was a very comprehensive explanation. So who's at risk for the disease?
So historically, HIV has been associated with just gay men. And that isn't true. Absolutely everyone can be affected by HIV, no matter your sexual orientation, your race, your age, ethnicity, gender, where you live, everyone can be affected. However, due to how HIV enters the body and how it affects people, there are specific groups that are at higher risk because of that. So yes, gay and bisexual men are the largest number of new diagnoses. That's followed by heterosexual and then injection drug users, so IDU users.
So then how is it contracted?
So it's contracted through sex, basically penetrative sex, sharing ejections. That can also be the equipment for injections and during pregnancy. Previously, blood transfusions and organs or tissue transplant was an issue, but with our technology today, it's carefully tested, so that's not really an issue that we see anymore.
Okay. So I'm going to interject a question. What are kind of the signs and symptoms, in leading up to how is it diagnosed?
Okay, so how it's diagnosed is usually within the first 2 to 4 weeks, a individual who is infected with HIV will start to feel like flu-like symptoms. So fevers, body aches, and that is usually the body, how HIV is affecting the body. For diagnosis, it's important to note that 91% of new infections for HIV in the US are transmitted from people not diagnosed or diagnosed but not in care. So that's why it's important that when we go to see our providers, that you're being open with your provider about your sexual history and providing them that knowledge so that they can do the proper screening. Also, on the other side, it's important for healthcare providers to ask those sexual history questions and make the situation comfortable, the environment comfortable for an individual to be open with their sexual history. But how it is diagnosed is through blood. With our medical advancements, now we have rapid HIV testing. So we have several locations throughout the state that can provide either 1 minute rapid testing. It ranges from either 1 minute to 20 minutes. Most places still have 20-minute rapid testing, but still it's very proficient at detecting HIV in the early stages.
Very good. So what are some of the type of treatment options then that are available, should somebody be diagnosed with HIV?
So HIV is a retrovirus. So antiretroviral therapy, or ART, is the type of medication that is given to individuals who are HIV positive. And that's usually, you go to a primary care doctor and you test positive, and then you will follow up with an ID doctor, which is an infectious disease doctor. And there's a wide range of medication. Previously, we had individuals who were taking sometimes a handful of medication, but it's not like that anymore. Some of the pills have different portions of the medication that are put into one pill. So it can be just a single tab regimen daily that can keep you safe. But also talking about medical advancements when it comes to HIV, it's also important to note that back in 1996, for a 20-year-old person who was living with HIV, their life expectancy was only 30. So now the life expectancy for somebody who has HIV is 70. It's roughly around 74, which is basically what the life expectancy is for an individual not living with HIV, who's HIV negative.
Wow, thank you. That's a great explanation. So, we talk a lot about diagnosis and treatment, but more importantly, how do we prevent HIV and the spread of it?
So, through history, we've seen how fear and stigma and lack of education has played into individuals getting HIV. And what I mean by that is we have to continue to educate ourselves and educating people around us about HIV. Knowing the risk for HIV and then knowing how to protect yourself will help prevent it. So when I say protect yourself, it would be using barriers during sex, or knowing not to use other individuals' ejection equipment, or utilizing needle exchange programs that we have throughout the state. So throughout the state, we actually have harm reduction centers. We have them in Asbury Park, Jersey City, Atlantic City, Camden, Newark, Trenton, Patterson. So it's important to utilize those preventative measures to ensure that you're keeping yourself safe. Another way is that by the use of PrEP or PEP, and being able to have an open conversation with whoever you're having a relationship with. So if you're HIV positive, knowing how to put that in a conversation to opening the doors to your partner to keep that individual safe. And on the other hand, if you're HIV negative, just having that conversation with your partner around using barriers for sex or getting yourself tested.
So when you say barriers for sex, I know, we've heard a lot of use of condoms. Are there other barriers to sex aside from condoms, or are condoms the best barrier for sex?
Condoms are the best barriers, but with our medical advancements, we now have PrEP. PrEP is pre-exposure prophylactics, and taken daily, it can reduce an individual's chances of getting HIV by 92%, and that is it's major for where we are today.
Very good. Well, I know you started telling us a little bit more about PrEP. So who should consider actually taking it?
So PrEP is honestly for anyone, but the CDC does have recommendations about who should be on PrEP. So a person who is in a relationship with an HIV positive partner should be on PrEP. A person engaging in non-monogamous sex with a partner who has not been tested, or they're just unaware of their status, should also be on PrEP. Gay or bisexual men who are engaging in condomless sex, or have been diagnosed with an STD within the past 6 months. And individuals who are using injection drugs or have used injection drugs within the past 6 months should be on PrEP.
Very good. So how effective is
PrEP?
Is it safe? Yeah.
Oh, yes. PrEP is very safe. Just like anything, when you start taking something, usually you'll have the side effects of nausea. That's just your body's way of trying to understand what it's taking on. Nausea, abdominal cramping, vomiting. Some people have dizziness or headaches, which I've actually heard a lot, which is headaches, and sometimes fatigue. There are long-term issues that can arise, which is decreasing kidney function, which is here at our office every 3 months we do a kidney function test, and also a decrease in bone density.
Okay, but overall it is safe, correct?
Yes,
Okay.
highly safe. The long-term effects that happen is very rare, and it's usually matched with something else that's going on with an individual.
Okay.
But it's important for a physician to monitor those things.
And those side effects that you described, they can happen. That doesn't guarantee that they will happen.
Yes.
So I just wanted to clarify for the audience.
Yes, and the ones that I had mentioned initially, like nausea, abdominal cramping, stuff like that, it's usually for the first 2 to 3 weeks that an individual will feel that.
Oh, okay, great. So I know one of the challenges for some of our community members is access to care. Is PrEP covered by insurance?
PrEP is covered by insurance.
Good news.
But but some insurances will leave you a copay of sometimes thousands of dollars. But the maker of Truvada, which is PrEP, Gilead, has multiple programs for individuals. So it will, if you qualify, which majority of our patients, we've only had one that didn't qualify throughout this time that we've been providing PrEP. They completely knock out the complete copay cost, and they'll cover it for a year, and after a year you just have to renew it. So it's not like, oh, you can only use it once. You can use it continuously. And then for people who are not covered by insurance, Gilead, again, the maker of Truvada, which is PrEP, they also have programs for these individuals. So literally I will help our patients sign up online really quick. We'll get a number back immediately. They can walk over to the pharmacy and get a 30-day supply. During that time, I will help them get the 3-month supply, which is submitting more information. So there are different ways out there. Just give us a call, the crowd, and we can definitely help you.
So that's like a medication assistance program.
Exactly.
So that in the long term, they apply for a program to get medication, either
Exactly.
at free or at no cost.
Exactly.
That's great. Okay. So what is the difference? You mentioned PrEP. Can you explain what the difference between PrEP and PEP is?
So PrEP, when you think of PrEP, you think of PR. So that would be prior to something actually happening. So PrEP is used prior to an exposure, and it's taken until that you and your provider feel that you are no longer engaging in a high-risk behavior. Whereas PEP would be post-exposure prophylactics. So that's taken 72 hours, which is so important. I can't stress that enough. You have to come in as soon as you feel that you've had an exposure. You can seek out emergency room, or you can go to your primary care doctor, proud, and we can prescribe PEP. And PEP, you're on it for usually 28 days. And as soon as your 28 days are up, that's all you have to take. Now, from that point, if you want to take PrEP to help prevent future exposure, then that would be something that you should definitely look into.
So, do both of these, do they work against other sexually transmitted diseases?
No.
PrEP and PEP?
PrEP is solely for HIV. We talked about ART. So PrEP solely targets HIV. It does not target other STDs. So it's important that if you are using PrEP or PEP, to still use barriers during sex and still protect yourself.
So can you maybe speak to kind of some of the services that you provide?
Yes. So from the time that you walk into the door with Proud, we are LGBT friendly, 100%. All of us are highly trained when it comes to LGBT healthcare, including our providers. And our providers like to take that extra time to get to know you, get to understand you, and give you the space to feel open and free to have those conversations, which is very important. On top of that, we do our own testing in our office. So if you come in seeking PrEP, you don't have to go to a LabCorp, you don't have to go to Quest. You can sit right where you are in our office and we will draw the blood right then and there. Also, we do counseling around PrEP. And that usually comes from our provider or it comes from our nurse. And for individuals who are seeking PrEP and don't have insurance, or they have insurance, but they know that their copay is really high, then they can come sit with me and I will help guide them with that. So we kind of provide the all-around circle in that. And we also do a lot of education on what is PrEP, what are the side effects. We make sure that when you leave that you have a good understanding of what you're getting yourself into when it comes to PrEP.
So you mentioned you do testing. Do you do the rapid HIV testing
Not
or just
yet.
HIV? Do you do any HIV?
Yes, we do HIV
Okay.
testing, but that is a blood draw. But we are linked with Zufall, which is less than 3 minutes away from our office, and also Hiv AIDS Foundation, who do rapid HIV testing.
Very good. So at this time, I would like to questions from our audience. For those of you online, to ask a question, you just click on that chat feature, and you can post a question, and we will be happy to answer your questions. So there is a question from one of our audience members. So if you are pregnant and have HIV, is there a 100% chance of passing it on to your child?
No. Because of the advancements that we've had, we rarely see that now. So somebody who's HIV positive, there are precautions that are taken during pregnancy and during labor to ensure that the chance of passing it on to a baby are reduced.
Are there any risks to that child?
Any risks to the child? Not really. Yeah.
Another question is one of the signs and symptoms of HIV and AIDS. I think we covered some of that, but if you could reiterate it and just kind of maybe go in a little bit more depth, that would be very helpful.
So basically, the majority of the signs and symptoms are like flu-like symptoms. So having a headache, body aches, feverish. Those are the type of things, and sometimes it's kind of hard to tell, like, do I have the flu or did I get exposed to something? And that's basically the symptoms.
So when does HIV progress to AIDS?
When does HIV? The progression doesn't always have to happen. So an individual can have HIV, have an extremely normal life, and never be diagnosed with AIDS. The progression happens, we see a lot with patients who have been out of care or were not linked to care fast enough. And that happens when the T cells or the CD4 cells drop below 200.
So it is important, like you said earlier, that as soon as you feel like you've been exposed, to come on in and get it checked out.
Oh, yes. The quicker that you do that, the quicker the medication can work to stop the progression.
So this is an excellent question from our audience member. Are there certain lifestyle changes like diet or exercise that are recommended to help prevent or manage HIV?
So to prevent HIV, that would be protecting yourself when it comes to sexual interactions, using barriers, so condoms, and also using PrEP. So as far as lifestyle changes when you actually have HIV, to avoid wasting, which is something that happens to individuals who have HIV, it's important to keep regular exercise, get your flu shots and be up to date on all your immunizations, because anything that, because HIV is attacking your immune system, it's important for you to keep your immune system boosted in any way that you possibly can. I mean, diet, exercise, and yes, proper sleep, all those type of things, they really play into your body, keeping your stress levels down, doing those things of going to even support groups to help you mentally, just keeping your body at basically like an equal and balanced level.
So if there are no questions, then this will actually conclude today's webinar. We thank you for joining us. Please remember that the opinions shared here today by our medical expert are not a substitute for medical advice from a physician. If you need a physician, please call 1-888-724-7123. And for more information about Robert Wood Johnson University Hospital Somerset and our PrEP Health, please visit www.rwjUH.org/Somerset. Thank you so much for joining us today, and have a great day.